And so today we're, as part of the implementing self-measure blood pressure program in your clinic setting, today's session, or session 2, is on training patients to do the self-measurement. And our objective for today is to review the techniques for accurate blood pressure measurement. I'm going to have Elena pull up our polling questions to get us started.
Thanks, Jerry. Yeah, so each week we'll kind of do a poll at the beginning of the session that just kind of goes over what we talked about last week. You're not being graded or anything. We just want to make sure that we're conveying the correct information. So I'll launch the polling, and then once I see that you've both taken them, I'll make sure to let you know what the correct answer was. Perfect. All right, you guys got them completely right. So what is SMBP? A patient measuring his or her own blood pressure at home, and then who benefits from SMBP? Really, pretty much everyone can benefit from it. Those with a diagnosis, those without a diagnosis, and including those patients with barriers to coming into the office. So great job, everyone. Thanks for, obviously, what we taught last week really pulled through. So we appreciate that.
Yes, thank you. Thanks, Elena. And there we go. Oh, I got to close my poll. One of the other things that we're going to do every week, as Elena discussed at the end of our session last week, is that we have you doing an action plan or action planning from one week to the next. So at the start of each call, then the next week we'll cover what those parts of your action plan were and how you did, or if you had any questions about it. So from last week, we were talking about who are your clinic champions and who are you targeting for SMBP? Are they your uncontrolled hypertensive patients, your newly diagnosed, maybe those patients with white coat syndrome, or those who experience barriers to healthcare access? And then also we asked you if possible to pull up a list of those patients. And just kind of in a round robin manner, if Jennifer and Teresa, if one of you wouldn't mind starting, maybe sharing, if you had a chance to work on this, you know, what would you like to share about the action planning activity? Jennifer, Teresa, I don't know. We can't hear if one of you is trying to talk.
Sorry, I'm trying to
Oh, we can hear you, Teresa.
Teresa.
Yep, gotcha.
So I guess it would be just me as the champion. I don't have I was looking for my list too of the action plans, so you might have to help me through. We are looking for to start with our uncontrolled hypertensive patients. That's kind of, give me just a minute.
And I didn't mean to put you on the spot either. It's just, yeah, it's just kind of gives everybody a chance to share, you know, maybe some of the activities they might have had a chance to work on from week to week. So yeah, basically who are your champions and if you're targeting anybody specifically. And
yeah, it would just me and then the uncontrolled blood pressure patients.
And are you able to pull a list of those patients?
Yeah.
Great.
Yep. That was I was looking for. I was looking at our gap list for hypertension, controlling high blood pressure, and we're looking at about 2,000 patients in our practice.
And then I see we've also been joined by Jennifer Davis and Jamie Imperial. Am I saying, I hopefully I'm not saying that incorrectly. Sorry about that.
Nope, that's correct. You're right. Hi.
And welcome to both of you.
Thank you.
The activity we're talking about is action planning, and we'll cover it again at the end of the call. Each week, we will have you do action planning for the coming week. And it's basically some questions to work on. And so last week, the questions were, as you see on the screen here. So you probably wouldn't have had a chance. I'm thinking Jennifer Davis and Jamie haven't had a chance to work on them because I don't think either of you were on the call last week, correct?
No, we were not.
And that's fine. That's fine. We'll talk a little bit more about action planning, but as you can see here, these are just some things that if you had a chance to work on from week to week that we were focusing on. I was going to ask Jennifer Jarday, did you have a chance in your clinic to work on the action planning?
We're not from a clinic. We're actually from a physician organization, and we were asked to join this
Okay. Oh,
training by our leadership.
Yep, Jennifer gave us. And that's okay. No, that's fine. And then we have another Jennifer.
Oh,
Jennifer.
I'm sorry.
Oh, no, that's okay, Jennifer. That's fine. And actually for both Jennifer Davis and Jamie, if you want to share in chat, maybe, your name, where you're from, your facility, and, your location, what state, what city, would be great too, since you're new to the collaborative. Just to get us, we can all know a little bit more about you. And then I was going to say, so Jennifer Jarday, you were on last week, right, Jennifer? I didn't know if you had a chance to work on the action planning. Okay.
I know Jennifer's joined by phone, so if you're having trouble unmuting, it's *6.
Got you, Jennifer.
Can you guys hear me now?
Yep, we can.
Yes.
Awesome. I was talking to myself a lot. Yes, I'm joining by phone. My desk computer doesn't allow me to call in. So for us Clinic Champions, I was on last week. I got logged in late, so I missed part of it. I did go back and watch it. For us, our Clinic Champions would be navigators, which are basically like care coordinators in our clinics. To start with, I think that we would target actually our white coat patients. So as we're doing registry work with our D5 patients or IVD, a lot of these patients that are falling on these registries and not meeting their blood pressure goals, oftentimes we're stuck on the same patients where the provider's answer is, well, they get white coat syndrome. So I think that would be a good place for us to start. And as far as we didn't necessarily pull a list, we're looking at these registries monthly. So it's, as we would come across these patients, it would just be a good intervention.
Well, great. Well, it's glad to hear that, Jennifer and Teresa, you guys have done, it sounds like a lot of work in between. And as you can tell, it's not, I don't want to make it sound like it's a huge homework assignment, but just, a few things you can work on between each of the sessions. And then we will again talk a little bit more about it at the end of this session to prepare for next week's action planning.
Jerry, really quickly, I wanted to ask, both Jennifer and Jamie put that they work with McLaren Physician Partners. So I just wanted to see with McLaren, then they're located in Michigan. Do you refer any patients, or do any of your clinics that you work with have self-measured blood pressure programs or anything like that, or is this completely new?
I believe McLaren as a whole is developing some type of education. We developed them for our independent providers, as we don't just have employed offices. So we created just like a little module that did include like the white coat hypertension. So we were just asked to join this just to see what else maybe we could improve on.
Awesome. Yeah. Hopefully, I think this action plan would be a nice thing that you guys can take and send to your clinics to kind of get prepared if they want to employ a self-measured blood pressure program within their clinic. This action plan that we're talking about, which I'll send out in a follow-up email, that kind of walks you through the whole process of what you would need to do in order to get started.
Thank you.
And one of the things too that we talked about as part of these sessions is we're hoping to make them as interactive as possible. So, I don't want you to feel like it's super formal. If you have a question, please just, feel free to ask. You can ask either in chat. Elena will be keeping an eye on chat for us, or, just let us know if you have a question at any time. Another way to hopefully make this interactive, for today's session, we are going to also be doing a blood pressure scavenger hunt. And so as a scavenger hunt, you can do from your seats. You don't have to get up and run around. We're not going to have you look for things in your house or your offices. But periodically throughout the training, we're going to ask you to notice some things about yourself or your environment. And then we'll have you score them appropriately. And just like for golf, low score wins. So our first question for the scavenger hunt is, are your feet on the ground and your ankles uncrossed? If your feet are not on the ground or not supported, or if you have your ankles crossed, then you need to give yourself 10 points. And now next, I'm going to show you a video on doing it's a patient-facing video that you can use for doing self-measured blood pressures. And as you can see at the bottom of the screen there too, we've got the link to the blood pressure, to this video if you want to use it.
Self-measured blood pressure monitoring is important and needs to be done correctly so it can be used to help improve your health. Let's review the basics. Self-measured blood pressure monitoring is when you measure your blood pressure while not at your doctor's office or another healthcare setting. Self-monitoring will help your care team gain a more complete picture of your blood pressure over time. This is most commonly done at home. The American Heart Association and American Medical Association recommend using an automated, validated device with an upper arm cuff, and preferably one with memory that stores at least 30 blood pressure readings. If you're unsure, ask your doctor or pharmacist for advice. Typically, you can measure your blood pressure with just a push of a button. Make sure the cuff you're using is the right size and fits properly. If you are not sure, ask your care team. Many factors affect blood pressure results, so it is critical you follow the instructions your care team provides on how to properly self-measure. Watch this video closely. If you have any questions, ask your care team for help before getting started. Let's review, step by step, how to properly self-measure your blood pressure. First, be prepared. You will be taking your blood pressure twice each morning and twice each evening. If you take blood pressure medication, measure your blood pressure before you take your medication. Prior to measuring your blood pressure, make sure you empty your bladder and avoid exercise, caffeine, and tobacco for at least 30 minutes before getting started. Find a quiet space without distractions. Second, get in the right position. Sit with your back supported and do not cross your legs or ankles. Have your feet flat on the floor. If your feet don't reach, place them on a stool or other object so they are supported. Rest the arm you will use to measure your blood pressure on a firm, flat surface at roughly the level of your heart, which is about mid-chest. Have the palm of the hand of that arm face up to relax all of the muscles in the arm. Place the blood pressure cuff on your bare upper arm so that the bottom of the cuff is just above the elbow. Once you are positioned properly, rest quietly for 5 minutes before taking the first measurement. Third, while measuring your blood pressure, do your best to make sure the room stays quiet and avoid talking with anyone, watching or listening to TV, and using the phone or other electronics. Perform your first measurement. When completed, write down your blood pressure numbers and your pulse that are displayed on your device. Wait 1 minute. Then repeat for your second blood pressure measurement. Write down your second blood pressure numbers and your pulse. Your care team may give you a form to use to write down all of your blood pressure measurements and pulse. Continue your self-measured blood pressure monitoring routine according to the instructions given to you by your care team. Report your blood pressure results to your doctor's office in a timely fashion, and be prepared to discuss results and take action if needed based on the information you provide. Self-measured blood pressure monitoring is a great way for your healthcare provider to get a more complete picture of your blood pressure. For confirming a diagnosis, assessing blood pressure control after changes in treatment, and monitoring blood pressure control over long periods of time. Remember, you play an important role in ensuring the results your physician or healthcare team receives are accurate. With accurate information, your care team can come up with the best treatment plan for you to improve control of your blood pressure.
We are going to move on to our scavenger hunt for item number 2. And that question is, are your legs uncrossed? And if you have your legs crossed, give yourself 6.5 points. And I see we had someone else join, it looks like, from a 507 area code. So if whoever that is, welcome. We're just really getting started here into the meat of this presentation. And if you wouldn't mind just sharing in chat your name and where you're from, your facility, and your location in your state. be great. Thank you. So moving on. These are the, as you saw in that video that we just had, it does cover a lot of what we're going to cover today on our call. We're just going to get in a little bit more in depth into it about training your patients to do their self-measured blood pressures. And we have 10 points here on this slide that we'll be discussing in more detail in the following slides. So let's take a quick look at those, but we'll really be going through, talking about how to train the patients to prepare and take their blood pressures at home. So the first point that we're going to cover today is discussing what self-measured blood pressure is and why it's important. You want to start by finding out, what does your patient already know about SMBP, and what are their concerns about maybe doing this? Also, if you can explain to them why it is important to be doing this at home, and what the importance of controlling their blood pressure is, why it's important to have their hypertension under control. And also it's important just to provide them too with some general resources or information about hypertension and SMBP. Again, one of those things can be in the video that we just shared. And now we have another scavenger hunt question. This question is your back supported? If you're seated but your back is not supported, give yourself 5 points. As I talked about on the previous slide, we want to be able to share resources with our patients about self-measured blood pressure and about the importance of, keeping your blood pressure under control. This slide shows a couple of different resources that you can share. They're from Target BP, from the American Heart Association, and one talks about self-measured blood pressure. The one is the video that we just showed. And then we have another one in Spanish that you can also share. The second point that we like to talk about is teaching your patients how to use their device and assisting them in using that device. It's really important to ensure that the device, the loaner device that you're giving your patients has the correct blood pressure cuff size for them. As you know, if the blood pressure cuff doesn't fit properly, you can either get a too high blood pressure or too low pressure if it's not a good fitting cuff. So it's important to have your patient, while they're standing, measure their arm using a tape measure, of course, and place it starting up at the acromion process, which is the boning process at the top of your shoulder, and bring it down then to the olecranon process, which of course is your boning process in your elbow. Then when you take that distance, divide it in half, that is where you'll measure the arm, the circumference of the arm. By knowing the circumference of the arm, then you know what size of blood pressure cuff to make sure that patient has. Now we have item 4 of our scavenger hunt. And this question is, are your arms supported at heart level? If they're not, then give yourself another 10 points. This slide shows us what the acceptable blood pressure cuff bladder dimensions are. So taking that arm circumference that you measured in the previous slide, you'll know what size blood pressure cuff to give to your patients. Again, it's important to make sure that for an adult, it encircles at least 80% of the upper arm. And then for children, you want it to encircle at least 100% of the upper arm. If a cuff is too short or too narrow, it will give you a high blood pressure measurement. And a cuff is too large, will give you a low measurement. So that's why it's very important to make sure that we have the right blood pressure cuff size. Continuing on when talking about teaching and assisting your patients on how to use your blood pressure device, you want to suggest to them that you make sure they have a validated automated upper arm blood pressure device that they're using. And it's best if it's one with a memory and averaging to it. This is if they already have one and you're not loaning one out. We don't recommend that they use rest cuffs unless, of course, they aren't able to do a brachial reading. Also, we don't recommend finger devices. They should never be used. If your patient has already purchased a blood pressure device, have them bring it in to your office so that you can do some accuracy testing on it, because that's important too, that they get tested on a regular basis to make sure they're still measuring the blood pressure correctly. Now we have scavenger hunt item number 5. Living up here in Minnesota, Michigan, and Wisconsin, we know that we're probably dressed in layers at this time of year. So if you're dressed in layers, give yourself another 27.5 points. And we'll talk again, as they did in the video, about the importance of what to do if somebody is dressed in layers. Okay. Here we have our final slide on teaching our patients about how to use their device and assist them in using it. It's important to make sure that you're positioning that blood pressure cuff on bare skin and that it's properly positioned on the upper arm, as we saw in the video. You can refer to the manufacturer's user manual for instructions that you'll send along with them so that they know how to place it correctly, and also to make sure that the tubing is placed correctly. Also, you want to tell them, of course, how to turn the device on so that we'll start doing the measurement. It's also important to explain to the patient about the process. So as the cuff finishes deflating, that's when they're going to get the reading that's going to be displayed. That's going to be their blood pressure, and explain to them what the different readings mean. The top reading, of course, is a systolic reading, which measures your blood pressure as the heart beats, and the bottom number is the diastolic pressure, which measures the pressure in your vessels when your heart is at rest, so that they can understand the difference between the two numbers. I know a lot of times people will ask what those two different numbers mean. So next we're going to talk about educating our patients on hypertensive emergencies. And so we'll cover a little bit more about this in the upcoming slides. So basically, what does a patient do if they have an abnormal reading, and when should they call 911? First, though, we're going to go to scavenger hunt item number 6. And this item is, are you talking? So if you're having a conversation right now, give yourself 6 points. So I guess I have to give myself 6 points. Okay, as I talked about on the previous slide, we're going to cover what the difference between hypertensive urgency and hypertensive emergency is. So for hypertensive urgency, if your patient, if they get a blood pressure of 180 over 120 or greater, and they've rechecked it and got similar results, but they're not having any symptoms, then they should call their primary care provider. For a hypertension emergency, this is when if they are taking their blood pressure and it's 180 over 120 or greater, and they've rechecked it, and they're also having symptoms such as chest pain, shortness of breath, numbness, weakness, change in vision, they should call 911 in those cases. So next, as they're getting ready to take their blood pressure, make sure that they understand some of the things that they should do before they take their blood pressure. Again, these were covered on the video, but it's important that they don't have a full bladder. So if they need to use the bathroom, they should. Make sure that the patient rests for about 5 minutes in the chair before they take their blood pressure, that they're not, hurrying, sitting down and then taking their blood pressure. Take a little bit of time to relax. They shouldn't be talking, they shouldn't be on the phone, they shouldn't be texting, and they probably shouldn't be also watching TV or anything during the blood pressure, just kind of sitting and relaxing. Also, nobody else should be talking with them, just give them a little time to relax. Ask your patient to measure their blood pressure prior to taking their hypertensive, antihypertensive medication in the morning and in the evening. Also remind them to wait at least 30 minutes after they've eaten to take their blood pressure. And if they smoke, make sure that they wait at least 30 minutes after they've had their cigarette or that they've smoked and before they take their blood pressure. Now we have another scavenger hunt item. It's an item number 7. So again, if you need to use the restroom, then or have a full bladder, then you give yourself 10 points. This poster here is a nice helpful little guide about helping your patients be in the correct position when they're taking their blood pressure measurements. So you want to teach your patient to make sure that they're seated on a chair that has back support so that their back is supported when they're taking their blood pressure. Make sure that their feet are on the floor. And if they can't reach the floor, that they're supported by some type of a stool that they can put their feet on. Make sure that their feet are not crossed, either at legs or even at the ankles. And also make sure their arm is supported. If they don't have a table or a stand that's high enough, to put their arm on some pillows, that would help. Also, the blood pressure cuff needs to be on a bare arm, and it should be at heart level. So again, this is a poster from Target BP from the American Medical Association. And then here are just a few other factors that can impact blood pressure that you'll want to share with your patients so that they're aware of them when they're taking their blood pressure. Anything such as nervousness or stress or anger, like even in the office, if they've been waiting in the waiting room a long time, those can affect their blood pressure. We know that things such as your age and your sex and your race and ethnicity can affect your blood pressure. Lifestyle, diet, exercise, substance use, things such as smoking or alcohol or even vaping affect your blood pressure. Also, if you've recently had some caffeine, if you've used a decongestant or any over-counter medication such as that, or any nicotine, that can also affect your blood pressure. Talking during the measurement affects your blood pressure. Other things too that are factors are if you have air in the blood pressure cuff before measuring, making sure that you have the correct blood pressure cuff size, as we talked about before. And then also if the cuff is not evenly on the arm, if it's kind of, kittywampus on your arm, it won't measure correctly. Now we are on our bonus items for the scavenger hunt. Have you had caffeine in the last hour? If you have had caffeine in the last 30 minutes, so coffee, Diet Mountain Dew, or anything like that, give yourself 5 points. The sixth thing that we like to cover today on that list of things about helping our patients prepare for their blood pressure is teaching your patient how often they should measure their blood pressure. So as they said in the video, we want to make sure we have 2 sets of measurements each day. One should be in the morning and one should be in the evening. Make sure they're doing it before they take their antihypertensive medications. So, first thing in the morning, maybe when they get up or when they've had a little chance, I suppose, to wake up, and then again in the evening before they take their medication. Each set will be 2 measurements, and make sure you wait at least 1 minute apart before you take the two measurements. And so we want them to have them do this for 7 consecutive days. At a minimum, you need 3 days or 12 readings to get an accurate idea. The other thing we want to make sure is that patients are aware of how they should be documenting or keeping track of their blood pressure data. So as we talked about in our previous slides, you want to make sure that as they're taking their blood pressure and recording those blood pressures, that they know what to do, of course, if their blood pressure is too high or too low, or if they're having any symptoms. So when they need to call you for any issues that they might have. Also, you want to make sure you're working with your patients so they know how to communicate their results back to the practice after a full week of measurements. So how is this going to be done? Do you have an electronic portal that they can use, or is it just paper form? Maybe they're going to come back in and see you, or is that a phone call to the office? Now we're on our bonus item number 2. So have you smoked within the last half hour? And if you have, smoked or vaped within the half hour, give yourself 5 points. Okay. As we know, anything with technology can have errors or problems. So make sure your patients are prepared for dealing with any of the errors or problems they might have. show the patient what to do if an error does show up in their machine, you know, on how to start over and get a correct answer. And also provide the patient with instructions on what to do, including a number if necessary, if the readings are showing as abnormal, so they know who they can follow up with. You want to make sure also that the patient understands how to correctly measure their blood pressure. So you want to do this by using the teach back method to make sure that they show you exactly how to do a blood pressure at home before they leave. And if they have any questions, this, you know, you can answer them for them then. You know, this shows that they've learned what you taught them. And also, you know, it can help correct any mistakes or anything they might have misunderstood about doing the home blood pressure measurement. If necessary, you know, provide them with a second demonstration. And then also you can, there's a number of different links that we've provided in these slides for some resources they can use at home, you know, also you can provide them with print reminders or tips to help them remember what to do at home. Because we know not everybody, you know, might be as computer savvy, so it might be necessary to send them home with some printed items that they can use at home. Also, you want to make sure that the at-home device is accurate before you send it home with that. Yeah, as we know, even devices that have passed and accepted validation tests may not be giving accurate readings for every patient. So, or they may not have the correct cuff size if they've been using one at home. So it's good to check what they've been using at home just to make sure it's still accurate and works correctly. You want to make sure that they bring that device in and have it do multiple readings to make sure that it's still meeting the standards. And if you have, when you're doing the testing, if there is less than a 5 milligram difference between the two different methods that you've been using to check it, you know, using your blood pressure cuff at the office and then the one that they have, then it's safe for them to use at home. And then you should make sure that all accuracy checks are done after purchase and then on an annual basis. And then we have another patient training checklist from the AMA. It's a nice checklist you can use for loaner devices. The link is also provided on the slide, and it covers just a lot of different things that are part of, you know, checking the loaner device and using it at home. So just wanted to share that as another resource. Now we're on bonus item number 3. And were you doing moderate or high level physical activity? So if you're doing the, and I forgot his name and I remember watching him on The Fresh Prince of Bel-Air, but if you were doing that dance within the lab, then immediately before this, you need to give yourself 5 points. So now it's time to add up your score. So you want to take all the points from the 7 scavenger hunt items, and then also add up the points from your 3 bonus items, and then look at your total score. And we're going to go through what these all mean. So if during your blood pressure measurement, you know, we had little things that we were having you check. So if you don't have your feet supported while you're getting your blood pressure measure, that can elevate your blood pressure by an average of 5 to 10 points. If you have your legs crossed, it can elevate it by 2 to 8 points. If your back is not supported, your blood pressure can be elevated by an average of 5 to 10 points. If you don't have your arms supported, it can be elevated by another 10 points. If you can't remove your arm from the sleeve and the cuff is placed over clothing, it can be elevated by 10 to 40 points. I always feel this is really a big one, and I feel it happens a lot that people measure over clothes. If you're talking, 10 to 15 points, and then if you have a full bladder, another 10 to 15 points. So as you can see, if you just even look at the averages of those, I know we don't have them here, but it's quite a bit that your blood pressure can be elevated if you would hit on all of those. And then for those bonus point numbers that we talked about, caffeine, if you've had caffeine in the last 30 minutes, this can put your blood pressure up by 5 points. Same for smoking, another 5 points, and then doing physical activity, another 5 points. So if you want to take a look at your total score, you guys don't have to share them. If you, I don't think we're going to give out any prizes or anything, but I'm sure if you want to share them, you can. If you're having your blood pressure, if you look at that score and then look at, you know, how many points that can elevate your blood pressure, would that qualify you for a diagnosis of hypertension? And would you need to be started on medication? So that's why it's really important that people understand, you know, all the things and, you know, taking the blood pressure correctly and kind of avoiding those things right before you're taking your blood pressure that can elevate your blood pressure. Any questions on those or?
I know Teresa put in the chat that hers would be elevated by 42.5 for the layers and the arms not supported. So, and I know some people in the past, and we can, if there's interest, we can kind of, and Jennifer says 35, we can kind of break these scavenger hunt slides out and give them to you. Some people like to use them when they're doing competency checks. Jamie says 49. Yeah. So if you are interested in something like that, kind of is a fun way to show the people at your organizations who are taking blood pressures, why it's so important to follow all of these things. So we can definitely, I'll work on breaking those out and make sure to send those to you in separate slides.
I think it really shows just the common things that we don't even think about and how much it can elevate blood pressure.
Yeah. And there is like a physical score sheet that you'd be able to give to people. Obviously in this virtual space, we didn't have that, but I'll send that along as well.
So I just want to ask, before we move on to the action planning, any questions or insights or anything you'd like to share about what we went over today? If not, you can look at our action planning for next week. I'm just going to pull up the next slide quickly. And Elena, we'll go through the questions first, and then I'll let you pull up the actual document because I know Jamie probably didn't see it from last week. So what we're looking at for our action planning for next week is how are you enrolling your patients in SMBP? You know, are you doing outreach calls, point of care calls, or maybe you have another method you're using? And who is going to be your designated patient trainers? So, Elena, I'll let you pull up the document quick of what it looks like. Just to remind everybody and too, so Jamie can see it.
Absolutely.
Oh, I have to stop sharing. Sorry about that. That's my bad.
No, you're good. All right. So you can see the action plan over here. Again, this can be used. This is really just to help you kind of start getting organized around self-measured blood pressure. And the week by week won't always fit perfectly with what we talked about, but this is kind of just things you should start, the order in which you should start thinking about your program. So week 2, as Jerry mentioned, how will you enroll your patients to SMBP? Here are just a couple ideas. And then who are your designated patient trainers? Again, just a couple ideas, or if there are going to be some other people you utilize. CHWs, I know I mentioned in the first session that I work with several clinics in Missouri and self-measured blood pressure programs. And we actually did a separate program just for CHWs, and they were super interested in doing some of this work. So if you have access to CHWs, this could be a great way to utilize them. And later on in a future session, we'll get into specific roles that certain people can play. So if you're wondering, well, what can a CHW do? What role could they take on in this program? We can get in a little more in depth on what that could look like. But those are just the 2 questions for week 2 to kind of get you in the mindset of where to go next. And CHW stands for Community Health Worker. You're welcome. Yeah. Any questions on the action plan?
I did just want to mention, because Jennifer, which unfortunately she had to hop off, with us working with the physician organization, we're not with specific clinic. We have several clinics underneath our belt. So I don't really know how we would be able to, I mean, these are really great ideas that we would actually probably pass along to our independent offices.
Mhm.
But I don't know how we would be able to accomplish it.
Oh yeah, absolutely. If you don't have a specific plan that you're making for your one clinic, this wouldn't be obviously something that you can fill out. But again, yeah, like exactly what you said, this document is made more for the specific clinics so that as they're planning on implementing an SMBP program, they can take this and really step by step parse things out and kind of make up an SMBP policy. So this is how we're going to run who we're targeting. And this is how we're going to decide who gets enrolled. And this is how we're going to decide who's going to be the patient trainers. So it's really just kind of a framework on how to get started, and it parses it out into those steps, which could be beneficial.
Absolutely. Thank you. Yeah, this looks great. I would definitely see myself using this with my independent offices.
Yeah, awesome. Yeah. So again, like our round robins kind of at the beginning of each week, it's more so just made to share. Maybe some clinics have some good ideas that another clinic wasn't thinking about, especially with these other categories, or even how you do plan to utilize community health workers. That sharing session is more so to just share, just in case somebody else wants to take what your plan is and implement it in their system or clinic as well. So more so just for ideas. We're not taking this and doing anything extra with it. It's just kind of a sharing and networking opportunity.
That is actually all we have for today. I'm just gonna check again, see if there's any questions. I mean, it can be specifically about what we covered today, or if you have other questions, maybe about SMBP. This was our second session. We have 4 more. And so we work, you know, it's fine just to let people know too. I know not everybody's been able to be on every session, and that's fine if you're, you know, not able to join, you know, if somebody new wants to join again next week. That's certainly, we can get you caught up with the slides and the homework. So it's not homework, excuse me, action plans. Don't want to say the word homework, but just on the information. Anything anybody want to share?
And if you haven't had any extra thoughts since session 1, I know in session 1 we talked about some ideas that you had about reporting and things like that, about things we could cover in this. If you've thought of anything else since last week, or Jamie, if you think of anything that you'd kind of want to gain from this, we can definitely work that into our future sessions if it's not already there. So if you think of anything like that over the coming weeks, feel free to shoot us an email and let us know. And I know kind of session 4 and session 6 is where you probably could expect some of that extra information added in. So we appreciate all the feedback.
That's great. Thank you.
Thanks.
Well, if there's not any questions, we can certainly give you 15 minutes of your day back. I'm sure everybody can find something to do with that time. So we just wanted to make sure that everybody had their questions answered and got everything covered that needed to be covered. So we will see you all next week. Same time, same place.
Thank you.
Thanks, everyone. Bye.
Thank you. Have a good day.
You too. Bye.